Good evening. Good evening. This is Elder Brenda Stringfellow, and I want to welcome you all to Watch Global Ministries. This is one of the sessions that we held at our Be Free Challenge on Monday, August 24th, 2020. And our guest presenter was none other than Dr. Yolanda Harper-Morris. And she spoke about the cardio system. And so I want you guys to tune in and to enjoy and to learn about the heart, healthy heart, and the things that we as women, as individuals, as people can do in order to help ourselves to stay in good shape. So I'm going to share my screen. God bless you all, and I hope you enjoy our presentation on this evening.
Doing some things actively this week to improve our health. So tonight we have Dr. Yolanda Morris, and she is a doctor of nursing practice, and she is going to be talking to us tonight about cardiovascular health. And I know it's a lot of things that go on in our bodies, ladies, in which, especially our heart, sometimes we feel like we're having heart palpitations and all kind of things, and we don't know what's going on. Dr. Yolanda is going to discuss those things with us. She is an educator. She teaches nursing at the college level, of course, and she is just going to be explaining everything to us. She is an awesome woman of God. Before I introduce her, I would just like to say our president and CEO is Pastor Brenda Stringfellow, and she'll be on to greet you all a little bit later. But right now, we don't want to belabor the time. We want to give Dr. Yolanda as much time as possible to discuss what we need to know and to teach us some things. So, like I said earlier, if you don't have it yet, get your notebook, get your paper, get your pen, get your pencil, get your highlighter. I have mine right here ready to take notes and learn. And please share this information. Okay, God bless you all. And I'm going to turn it over to Dr. Yolanda Morris at this time.
Hello, everyone. Thank you, Minister Ela. I am so happy to be on. I think about cardiovascular disease, and it's one of the dear hearts to me. It's a topic of discussion that we need to know more about because as women, there are a lot of things that go on and that we don't seek medical attention for because we just think it, oh, it may be indigestion, oh, it just, it'll go away. But what has happened over the years, and me being a nurse over 30 years, I have taken care of people who have had heart attacks at young age, people who have died of heart attacks. And I'm quite sure you know someone who have had a heart attack in the past or people who haven't survived. So I thought this topic is very important for the women, and especially the women of color and in our community. So I'm going to start off and share a screen with you because I do have a presentation. Let me go back. Okay. And before we even move any further, can you see the presentation? Before we move any further, I have to say a prayer. Always the prayers in order. Heavenly Father, may the words that come from my mouth be effective to your people. I ask, Lord, that after this session, your people will seek assistance. They will get the ultimate help that they need. I ask that they ask questions and that they set healthy goals and that they move forward, they make doctor's appointments, and that they will spread the word to other people. Talk to your family. You don't just have to talk to the women, talk to all people. I ask that we be adherent to our medications and that we set healthy goals because when we know better, we would do better. I ask for you to strengthen us, strengthen our hearts, strengthen our minds, and strengthen our health. I ask for this in your precious name. Amen. Okay, as Mr. Elam told you, I am Dr. Yolanda Harper-Morris. I am the Vice President and Health Director of Watch Global Ministry. So we're going to talk about cardiovascular disease in women. Where am I? Where are you at? because people are in their 40s and 50s. What about your cardiovascular disease? A lot of people probably haven't even thought about it, because if you don't have any symptoms, you don't think about doing anything. But I want to set some health goals, because even if you don't have any issues now, there will become a time. So what we want to do is do preventative. We want to understand what goes on and say, hey, I did have some of those symptoms. Maybe I need to go check that. Okay. I'm trying to hit the screen. Ooh. Heart disease is the #1 killer of women in the United States. They claim more lives than all forms of cancer. How could that be? Well, you think about it. With cancer is something that happens like in a couple years, but cardiovascular disease is things that have accumulated over the years through our lifestyle, through our diet. And by the time we find out that we have heart disease, it's usually complications. It can end up in a MI or a stroke or even death. Now we're going to look at the statistics. If you look at all races, heart disease is 22.3%. And all races ranked #1 in the female. But when it comes to the white and black, there's a slightly increase in the black females' heart disease. Even though it doesn't seem much, it is. When you're talking about almost a percentage, why is there a difference? Then we need to think about it. Is it because we go to the doctor less, or we don't take the medications because we don't like the way it feels, or because our cooking style? So there's a reason we need to close that gap. And even though it's only 1%, this needs to decrease. Heart disease is something that can be preventable, and it should not be at the top of our list. Now, I want you to think about your lifestyle. I want you to think about what's going on. Do you have any of these two factors? Any of these two factors that are listed? Any of these two factors? We have people, you have high blood pressure. I think a lot of us are walking around with that. We're talking about high triglycerides. The triglycerides can be avoided, but this is the thing with triglycerides. It is fat. And fat, the triglycerides can be decreased if we were to exercise. If you burn your calories, your triglycerides would decrease. But if you don't, guess what? They are around a midsection. So a lot of times this fat stores a lot of triglyceride. So we have to work on that, burn the calories, and our triglyceride levels would go down. And we want to keep our cholesterol low, but we want to keep it good. All cells have cholesterol. So just remember, all of our cells have cholesterol, but when we eat, we add additional cholesterol, which can be dangerous, because the extra cholesterol that we get in our diet, it starts to build up in the arteries. Impaired glucose metabolism, people who have increased sugar, which we call it sugar. Sugar, what it does is it affects the arteries. When it affects the arteries, then the blood can't flow to the heart like it's supposed to. And that would decrease your blood flow to the heart. When you don't have adequate blood flow to the heart, the tissue can die. And the large waist, again, is dealing with developing triglycerides. So we got to work on that. I was like, oh my gosh, I got to really work on that large waist, because I can imagine what's being stored there, and I'm going to leave that alone. So we're going to work on burning our calories. You burn your calories, get rid of your triglycerides. Okay, what is coronary artery disease? It's a buildup of plaque in the arteries of the heart. As the plaque accumulates in the artery, guess what? The blood flow decreases, and if the tissue can't get blood flow, it can't get oxygen, and the tissue dies. Okay, so here, look at how patent this is. You got arteries, what it does, it supplies the inferior part. You got arteries that supplies the anterior. You got arteries to supply the posterior. So you have arteries, branches of arteries that's going everywhere. So they are supplying plenty of blood to all parts of the heart. Now, I like this section because this really shows what's normal. We can't see what's going on, but this is the artery. Look at it, it's normal, there's no plaque. Blood can flow freely through there, goes through the heart, pump out through the body, and it comes back. But as we get older, and depending on our lifestyle, look what happens. We start to get that buildup along the walls. So we have plaque that start to build up, and guess what? The blood is not coming through like it was. We got buildup. Here we go another 5 to 10 years down the road. We really have plaque buildup, the cholesterol, triglyceride, all of these things. And so here we got a narrow artery. So if the artery is so narrow, then guess what? The blood is not going to supply all parts of the heart. I want to go back and just show you that if one of these arteries is blocked with all of that plaque, this branches off. So that means it can be the anterior part and the inferior part that does not get blood. And so the tissue, what it does, it dies. And so here's another picture. Look at this. The block. And it's showing you this is anterior. That artery on the anterior portion of the heart was so narrow that no blood flow got to it, and so the tissue died. And so when the tissue died, there's no oxygen, and that is when you start to feel the pain. So when you feel pain, what did you do? What do you do? Some people say, oh, I'm gonna lie down, it'll go away. But what it is with this chest pain, it's a different chest pain. You feel like you having gas. This, people have said, feels like an elephant is sitting on their chest. And regardless if they walk, regardless if they take antacid, guess what? It is not relief. It is time to go. One of my coworkers, when I was working in ICU, didn't think nothing of it. She was always having a bottle of Tums. And I said, girl, what do you keep taking these Tums for? Girl, my GI system, my stomach, I get these heartburns. I said, well, if you're sitting there taking all of them Tums, it's got to be something more than that. So to make a long story short, it did not give relief. And, God covered her because she ended up having a blocked artery and she had to have open heart surgery. So it's a good thing that it did not, she only had, 2 blockages. But if it's blocked off a main vessel or artery to the major part of the heart, those are the people who drop dead. Those are the people. So you can't go and take them into surgery at that time because it has already happened. And then they find it on autopsy that they had a major heart attack. So I'd rather that we go seek medical attention whether we know what it is or not, because we don't know. Now, sometimes people do have a little indigestion, it goes away. But with that chest pain, a real heart attack, it is not going away. And over the years, I'm telling you, the plaque builds up and it builds up. So my suggestion is go seek immediate attention. When you go in, you said, I'm having chest pain, and you put your fist over there and you short of breath because you can't get oxygen because of your heart, people jump on you and that frightens you even more. But I just want to tell you what to expect, or when you have someone who calls you and say, hey, you know what, I think I'm having a heart attack, or, they're doing all this stuff to me, I'm scared I'm going to leak. Explain to them, yes, you need oxygen, but because they're going to slap oxygen on you, they put the EKG leads, you're like, oh my gosh, I'm dying. They give you medications. Sometimes they give you 3 and 4 different medications. It's okay to have 3 and 4 different medications because guess what? they all do different things. So they give you oxygen because you lack oxygen, and they want to supply oxygen to the tissue. Now, one of the things that they draw lab for, you want to see if the person is having a heart attack. That dark area with the black tissue, what happens to that dark area? It turns black and it sloughs off into the blood work. And it's a protein called troponin. So when the troponin shows up in the blood work, they go, oh, okay, yes, they did have an MI. But that can be very tricky because troponin doesn't always show up right away. That's why when they admit you into the hospital, sometimes you may be in there for a day and a half. They're going to draw labs every 8 hours. That second time, though, they start to see a rise. And then they do it a third time, and they like, oh my gosh, it went from 0 to 1 to a 2. So you're having an active MI. Sometimes the EKG, we look at a lot of the TV and they got the little nice, perfect thing. They have EKG changes. They like, okay, we think we need to get this patient to the cath lab. And that is just having an angiogram. And what they do is take these people to the lab. They actually go through the groin and they inject dye. And they look up on the screen because they want to see the patency of the arteries. And so that's a cardiac catherization. They can put a stent in. It's just like a tube to open up the flow. And I'll show you a picture of that. If that doesn't work, then they have to go and do an open heart. And I'm just gonna backthrow. If they had to just say that it's so blocked, or you got 3 or 4 blocked, and they said, well, we're not gonna put 3 or 4 stents. We just need to do a bypass. So when they said a bypass, a heart bypass, what they do is, if this area is blocked, they make another route. So they may go, where's my person? Okay, so say it's blocked here and blocked up in here, they will bypass that blocked area and come here and make a new route. So that's what a bypass, they bypass the affected area, okay? And just remember, even if you don't have anything of this done, if you have a heart attack, they take you through cardiac rehab. You are not gonna get back to the feeling the way you were. That takes a little time. But there is a regimen that you need to follow for a few weeks, because you're gonna feel like tired. The heart has to restore the function from where that area had died. Because there are other areas of the heart that will pick it up, but that particular area was affected and you will feel it. Okay, so this is one has happened before where they say, we're gonna put a stent in. So the cardiac stent is they go through, they put a balloon, and guess what they do with the plaque? You can't move the plaque. So they inflate a balloon and push the plaque against the wall. So when they push the plaque against the wall, they leave this device in place. So now you got a good new avenue. Good. This is a good blood flow. So it returns to normal blood flow. Now, you can be very careful because sometimes that plaque can come loose. They can go other places, but this has been known to be 99% effective. And so to restore the blood flow, this is, please, when people say do a stent, they're not cutting you open or anything. They're going through the groin. You will be awake. That shows you how, it's not so invasive because they just gonna put an incision in the groin and then they're gonna run a catheter through there. And before you know it, you come back and all you have is a bandage or a little white covering in the groin. That's cool because it didn't used to be like that. And the only bad part about it, you have to lie flat on your back in the bed from 6 to 8 hours. Now, because they put a stent in and gave you a new avenue, a good avenue for blood flow. This is plastic coating, this stent right here, so things won't stick to it. But it doesn't mean that you can go back eating fried chicken. and going to one of my places that my husband liked to take me to, Harold's Chicken. So they will put you on medications because they definitely want to make sure that there's nothing sticking. You may have to take Lipitor, which that helps with the cholesterol level. Take it, please take it. And then you got to change your lifestyle. So you got to spend, it doesn't say that you can go back to doing what you used to do. It's like, okay, I need to exercise. I need to I can't get that, that round, that gut. I need to get rid of that. And I need to look at the labels on what I eat. We're going to do some exercises. So almost in about another 10 to 15 minutes, what I want to do, we're going to calculate some things. We're going to set some goals on what we can do to prevent this. But let's go back and look at our health history. Do you have a history of diabetes? Do you have a history of a hypertension? Look at all of those things. What have the doctor have told you over the years? Look at your health history. Look at your demographic areas. Are you living in an area that you have access to food? Or like in some of the areas we have, everybody doesn't have a Jewel's or Mariano's that they can go to. A lot of stuff is fast food. We go to the restaurant, get fast food, access. Look at the demographic. Do you have access to medical attention? If you live in, depending on what area you live in, you may go to a hospital that if you get there, they got to send you out. So do you have somewhere, do you have a way to get to the doctor? Okay, family genetic history. A lot of times with family, they ask the doctors, they ask you, well, can you tell me about your mother and your father? Did you have anybody who had heart disease? Because that kind of let us know that sometimes things are genetic. Regardless of what you do, you have heard people say, Earl, my father, my brother, and my sister, they all had heart disease. So it runs in the family. So when you find out that things run in the family, that should make you even more like, I got to really be careful because this runs in my family. Cultural and social factors. Okay, you guys, what do we cook our food in? What do we cook our food? We know to have greens and fat back in the greens and, chicken fried. Don't bake me anything. I want my chicken fried. I want my fish fried. Social factors. When we're talking about smoking, drinking, if you're unemployed, that makes you even at risk because you're not going to be able to buy healthy food or eat healthy. So, one of the things I always tell my students when they go in to assess a patient, because everybody thinks, well, all they have to do is stop. They don't have to eat this and that. But if you're very limited on your income and you're eating from these food pantries, the canned goods are high in sodium. That may be where they get their food from. So you can't tell them what to do, but you can ask, tell me, what do you have for lunch? What do you have for dinner? What you have for breakfast? You can work with them to revise their plan. So if they have to eat out of a can of soup and it's high in sodium, you tell them, rinse it off. Rinse it off with water. So those are the things. So we can't do anything about social factors. So we have to teach people where they are. Now, I'm going to ask a question, and I want you to put it in the check box. Modifiable. Risk factors that are modifiable. What can you change and what you cannot change? So what is modifiable? What can you change? Anything that you do, a person does in a lifestyle that they can change. What do you think? Can you change? Can you stop smoking? Eat more vegetables? That's your diet. Exercise more? Yeah. Those are the things that you can change. Now, what you can't change, what is something that you cannot modify? I give you one hint. Age. You can't change your age. Can't do anything about that. Can't do anything about what else? Genetics, you can't do anything about that. You can't do anything about your race. And you can't do anything about your family history and your sex, your gender. So those are the things that you cannot change. But the modifiable things is, please, you can change that. The smoking, the drinking, and your diet. And get rest and exercise. Definitely. Definitely. I'm going to want you to pull out your phones in a minute, because what we're going to do is we're going to do some calculations. All righty. We're going to set some health goals here. We have a weight management. We're going to do some things. I'm not going to get too much in healthy eating, because Bishop will be doing it on the eating and exercises. If someone is doing exercise tomorrow. But what about regular physician visit? How often do you go to the physician? You don't have to be, because you don't take any medication, not go to the physician. You want to maintain health, okay? So how often do you go to the doctor? How many? I want somebody to answer in the chat box. How often do you go, or you think you should go? I can tell you I'm required to go every 3 months, because they won't renew my prescription. And actually, Blue Cross and Blue Shield mandate that we do healthy checks every 3 months. And they will drop you if you don't follow up, because they said it is cheaper to maintain than it is for you to get sick, and they have to care for you. So they are one of the companies, the big companies would love to drop you. Okay, 3 months, yes. And so if you are on medication, they even have now that they have stopped, they have, like, the pharmacists and the doctors have an automatic stop on medications. If you don't come in there, you don't get your medication. So that's one way to get in there. You can get 3 months supply, and that's it. After that, you should go to the doctor. And you know what? And that's a good thing to do that, because things change. Things do change with people. Your weight change, your cholesterol change. So things do change. So every 3 months, if you're on medication, you can do every 6. Okay? Maintain a good blood pressure. We have to maintain. With the pandemic going on, we got to get our blood pressure kids in the house. Now, having a blood pressure 120 over 80 is kind of ideal, but it's different for everyone. But that bottom number is very, very important, because if that number is high, that means that the heart is not resting. And we don't want the heart working hard. So you have medications. I know a lot of people say, oh, I don't take but one blood pressure medication. Let me tell you about blood pressure medication. Blood pressure medication, they do different things. Some of them work on the vessels. Some of them work on your heart rate. They do different things. So if you're on 2 or 3 medications that does 2 or 3 things, it's okay. Don't think that one pill for blood pressure will handle everything. Medication compliance is very important. How many times have people stopped taking their medications and said, okay, I'm okay, my blood pressure is good, I don't need to take anything for 2 or 3 days. Why do you think your blood pressure is good? Your blood pressure is good because you take your medications every day. Now, if you don't take your medication, then you're coming in, you start getting a headache, then you're calling somebody asking for blood pressure pill. That is a no-no. Because what's prescribed for me may not be prescribed for you. And once you get this blood pressure out of control, it puts you at risk for a vessel to break. And usually it's in the brain. That's why people have strokes, because the vessel becomes weak. All of that strain and that pressure on the vessels. The vessels can only take so much. So people end up having stroke. So please keep your blood pressure down. And healthy eating is very hard. Now that they went up on all of the food, I've been searching like, oh my gosh, so what am I going to eat today? I have given up red meat. It's been 3 months. I don't miss it. I'm just waiting for the exercise to come in so I can kind of get good around the waist. Okay. Excuse me. Now, I want you to take out, if you can diminish your screen, or if you want to use your phone, and I want you to go into look in body mass index calculator. Because I don't want you to tell what it is, but I want you to be able to calculate your body mass. So this is an eye opener to tell you, oh my gosh, where I'm at. So if you can go on Google, look at the website, I want you to look at a BMI, which is body mass index, and do this calculator. It's a calculator. You're gonna plug in your height, your feet and your inches, and your pounds, and it's gonna compute what your BMI is. I can tell you one thing, I don't fall under the category underweight. So if you compute your BMI and you're greater than 30, and I'm not afraid to say I'm greater than 30, I got some work to do because I'm at risk for a whole lot of things. So that is one of the things you need to set your goal, do your BMI and see how far off, because you need to be down to 18.5 to 24.9. That's your normal weight. And a lot of us carry a lot of weight and we're short. It's not like we're tall. So I want you to write that off to the side, and I want you to be able to share this. And I want you to talk to your friends and your family and say, hey, you need to look at this and see how far you off. Okay. Now, when we go to the doctor, when you get a little bit older, in your 40s, depending on if you're at risk, this is not really clear. These are the two things that the doctor really is looking at, the first one, and that's your cholesterol level. Your cholesterol level. Now, they want to keep it under 200. A good one is 60 to 100, but 200 is a borderline. Now, I'm borderline. I'm at 198 the last time I checked. Before I go, I have to have my labs drawn. And when you have these labs drawn, when they say fasting, that means you don't eat anything because you don't want your levels to be abnormally high. Now, because I have an underlying condition causing my cholesterol to be up, I have to work even harder. Now, but he tells me every time, he's like, I'm going to put you on something. I say, I'm going to keep it going. I'm going to keep it under 200. That's the best I can do. If I can get under 175, I'll be good. So, I look at diet, and that was one of the reasons for me to remove the animal from my diet, because my cells got cholesterol, and then I'm eating an animal with cholesterol. So, and then, what we cook our food at is cholesterol. However, if a doctor has to put you on medications, you need to take it. But I want to avoid that other pill. So I'm not at that point yet. So let's make sure when you go for your checkup, if you haven't had it done, please have a cholesterol level done. Okay. You need to know where you are. Always get a baseline. You get a baseline with your blood pressure. You get a baseline with your overall health. because you need to see if you start shifting to the side, to the right, then you need to come back to the medium. You need to be in the medium. So the cholesterol level, they said less than 200 is desirable, but 60 is good, really good. Now, nutrition. Now you have to look at healthy eating. They're going to get into that, but look at this. Emphasize on vegetables and fruit and whole grain. Poultry, fish, not fried, baked. Look at what you're cooking your food in. What are you cooking your food in? You know, the oven fryer works well. There are people who they use it. And we have to watch the portion size that we eat. A lot of things that we have now have added sugars and additive. A lot of times we don't even know what we eat. But let's just look at the labels. But the healthy eating will cut down on the triglyceride and the additional cholesterol that we assume when we eat. Somebody said, oh, Jesus, my BMI. I know I'm not discussing it. I just said greater than 30, and I'm going to leave that. Okay. Are there any questions? So we can spend 10 minutes talking, things that you would like to talk about, or family members that you have experienced that you know that they don't want to go, they need to go. Are there any questions? Just want to tell you, you know, being a nurse over 30 years, it has hardened. I'm very humble, but I was very sad to see that a lot of us refuse health care. I have seen people come into the emergency room and they would walk out and say they couldn't afford it. But you came into the door for help. I have seen people have a massive MI and died on the table. In there, they made it and they stayed home a little bit long. You know, one thing we have an issue with is when we call 911. They don't always come. And depending on your zip code, you're going to end up going somewhere where you don't want to go. So a lot of times we will waste the time by getting in the car. But I just think that if we as people was just start looking a little bit early, if you know that your family has that genetic history, or you know there's a lot of coronary artery disease, you don't have to wait till 50 or 60 or wait till symptoms show up, because it may be too late. So please, you know, encourage people to go to the doctor. And I'm gonna tell you, people like, well, I don't have any insurance. What do you think the county is for? The Cook County is good. They have the best of the best doctors. Now, if you're looking for a la carte treatment and somebody to bring you a steak and be your maid, that's not the place to go. You have to go somewhere else. I'm not going to name those hospitals. But Cook County is a good hospital. And tell you the truth, if something happens, you'd rather go to county because they will save your life. They will save your life. Any other questions?
Yeah, Dr. Yolanda,
Yes,
there's
ma'am.
a few questions coming in. What is a healthy BMI?
Okay, we can go back. So it was 18.5. So here we go in this corner right here. A normal weight is 18.5 to 24.9. Anything over from 25 to 29.9 is overweight.
Okay.
Anything greater than 30 is obese.
Mm-hmm.
And I know you're like, well, where did you get this from? But that's, yeah, so they have, when you calculate it, they have a scale there. So this is the way to control your weight. This is something that gives you to be more physically active, to eat right, and start doing portions of food. You know, I think one of the things we have to get, which the exercising, that is very hard. And we don't always have to go to the gym. We can walk. And I know sometimes right now we're scared to walk, but it just exercise and just standing in place and they got all of this stuff on TV. I don't know if I would spend my money doing that, but I would stick to the weight maintenance, well, reduction by decreasing calories. Decrease calories, you don't consume fat. And if you consume a lot of calories, then you got to burn it. So if you eat it, then you got to burn it. Because if you don't, it's going to store as triglycerides. The fat will turn into triglycerides. And that's what we don't want.
Okay. I heard that grill is not good. Is that true?
That I haven't heard that the grill, what they talking about, the charred part? Grill is okay. Maybe the charred part, the charcoal, because it gives off certain chemicals. The burnt meat, yeah. The grill is good. And what do you grill it in?
Okay.
Yeah, because the oven, that's why a lot of people invest in the oven fryer. They really like it because you just spray a little oil on it and it's done. But grill, they have not changed it, but don't burn your meat because they do have chemicals, yes.
Okay. So good health is a lifestyle and not a pill or a diet. Why does the FDA allow so many to push diets and pills?
But the FDA, the Food Drug Administration, does not approve diet pills. They do not. And vitamins, should I say, they don't do vitamins. But, there's a lot of politics and money into that.
Mm-hmm.
And how many diets work, though? How many, we've been doing diets from years. When we was little kids, people say, I'm going to see the fat doctor. And let me tell you something, it's all up here. You have to train yourself to eat right. You don't need to take the pills. It's a money thing. Mm-hmm. It's a money thing. Now, some people may need assistance with doing that, but everybody, I don't suggest, I'm afraid of pills. You got to be very careful. That's why you have to seek medical attention before you start on any specific diet, any medications relating to diet, because they can interfere with your regular medications. Mm-hmm. So I know a lot of things, what work for you may not work for me. If I got a condition, I can't take it. Mm-hmm. But let me ask you a question. What happens when you stop taking a diet pill? Mm-hmm. So that means that you have to keep it and you have to keep it going. So the best thing is to develop a lifestyle of eating. That doesn't cost you money. Mm-hmm. But to say to visit the fat doctor, to get those injections, I heard all kinds of things. So those are, all I can say before doing that, just seek medical attention. The FDA approves a lot of things, but it doesn't mean that it's right for us.
Okay. I got about 4 questions right quick. The first one is, what about eating late at night?
Okay. It's late as night. How are you going to digest it? Mm-hmm. So a lot of times it is recommended that, if you're the type of person that goes to bed at 10 o'clock, you shouldn't be eating after 5 or 6. You cannot digest it. So it's just food. It's food that sits there and accumulates. And after a while, the older you get, what's going to happen is going to be GERD. It's also going to go up. So you need to be able to digest your food, drink some water, and so it can dissolve.
Okay, I'm going to have to do better. That wasn't my question, but I'm going to have to do better, Chief.
Yeah, so what I do, it helped me sleep better because I have GERD, is that because I go to bed around 10, 11 o'clock sometimes, mm-hmm. I stop eating after 7. But I eat from 7 a.m. to 7 p.m. Anything after that, I watch that clock. So after 7 o'clock hit, it's water only. And I don't have GERD as much. And then I kind of burn my food from walking around. Don't ask me why I'm not losing anything.
What about plaque in the legs?
That happens because you do have arteries and you have plaques, and they have had to do what happens with that, they don't put stents in, but they have had procedures that they have to go in and push the plaques but they don't leave a stent in. They have had their bypass, but I don't know what they have done in the last 4 to 5 years. But I know there are different treatments with laser, because when you have plaque in your leg, what it does is it decreases the blood flow to your feet. And then what starts happening is in your feet, you have a different color. You will see people with dark color lower legs. You will see them with pain because there's no blood flow, no oxygen. So you have vessels and arteries everywhere. And yes, you do get plaque in your leg as well.
Explain good cholesterol again.
Good cholesterol, we need good, all our cells need cholesterol. The problem is when we consume additional cholesterol, that makes it build up plaque. So we don't need all of the additional, we consume a little in our diet. The cells already has our walls, our cell walls, and our arms, our body. Those cells have cholesterol, and they need cholesterol to function. It's like a hormone. It's like a hormone. We need it to function. The problem we have is when we eat all the additional the additional cholesterol, and that's what makes build up plaque. But one of the things I forgot to bring up with the women, as we get older, also, our estrogen level decreases. And so, we need estrogen level, we need it, it helps with our memory, it helps us with our heart because it said, the estrogen is just good it's a hormone and we need it for functioning. But as we get older, we lose that estrogen. And so our cell walls of our arteries are not protected like they used to be. So we can develop cardiac disease from that. So what happens a lot of times, we would go to the doctor and we would say, I've been having a lot of problems, my cholesterol. They know that the cholesterol up, but then you start having a little discomfort, and then the memories. And you say, well, he says, yeah, I know estrogen. I can give you a little estrogen, but guess what? I'm not going to give it to you because although it improves cardiac health, it puts you at risk for breast cancer. So that's another thing that we have to worry about when we get older, that we lose an estrogen and it doesn't protect the heart like it's supposed to.
Okay. Why do we have chest pain and you're not having a heart attack or indigestion?
Now, there are different types of chest pain. You can have, but you got to be diagnosed. So how did you know if you have a chest pain, you're not having a heart attack? Unless you went to the emergency room and they said you're not having a heart attack, because that means the EKG is okay. That means the labs is not showing up. But what happens sometimes is that we have excess calcium that cause vasospasms in our chest, in our arteries. And that's what causes, but guess what? It goes away because they put us sometimes on nitrates. And what that does is dilate our vessels. But that goes away, the pain go away. But with the real MI, that chest pain doesn't go away.
Okay.
So there are different types of chest pain, and they call it angina. Sometimes, they checked you so many times and they say you're not having a heart attack. Okay, take this nitroglycerin home. So if you have chest pain, I want you can take up to 3 tablets, but that third one, you need to get out of there. You need to be going to the emergency room because this time it may be different. So some people will have a history of chest pain once it has been ruled out that they don't have a cardiac issue, that is not an MI.
Okay, so if they're having some type of chest pain and it's not a heart attack or indigestion, that's something that their doctor would have to.
He would tell you that because he has to rule everything out.
Okay.
He has to rule everything out. Now, sometimes people get chest pain and they say, oh, every time I move, I got chest pain. Then that's not cardiac. That's just musculoskeletal pain. That every time you move, you hurt. Because if you having a heart attack, I don't care what you do, that pain does not go away. If you having a little discomfort because you're out there doing exercise and you start feeling chest, but you sit down and rest, that's not a heart attack. So that's the difference. But if it's something that does not go away, you need to seek medical attention. Now, some people have went continuous, like I said, and they have to do studies and say, okay, you've been ruled out for MI, so this is just angina. And we're gonna put you on this medication for angina.
Okay, what remedies would you suggest for emotional or binge eating?
Water. So the binge eating, okay, so like I said, this is something that we have to take in my mind what we're not going to do. What you need to make a plan that if things don't go right or you're upset, what can I do? Refrigerator's up, I can't go there. Just like I know if I missed my time, that's why I had to eat before I got on, because I knew after 7 o'clock I couldn't do anything. So I'm still hungry, but guess what? I'm just gonna drink water and go to bed. But please do not let food be emotional thing. You can get a puzzle. You can do something. Look at a movie, a boring Netflix movie. But do not food should be X'd out. That should not even be on the agenda. No potato chips. Find something else to do with hands. If it happened and you know it, clap your hands. Don't chew gum. Don't chew gum, because gum make you hungry.
Okay.
Gum make you hungry. So you got to find something else. That's an emotional thing to eat.
Is it true that if you are on blood pressure meds, you should not eat grapefruit?
It all depends on which medication it is, because some medications does mess with the effectiveness of the blood pressure. And so the doctors should tell you that, and some of the nurses will tell you when you prescribe, like I think it's Lipitor. I think it's Lipitor that you have to avoid, like grapefruit juice. So there are some medications that you have to avoid food with it. And then a lot of times they will tell you, it says, I have to take my medication after I eat. If they instruct you to take the medication on an empty stomach, you need to take it on an empty stomach, because it will be more effective. Food sometimes interfere with the absorption of the medication. And so what happens is you wonder why the medication ain't working. Be compliant, because what happens when you're not compliant and you're not doing things like you're supposed to, when you go to the doctor, he's like, oh, your medication is this is not working. Your blood pressure is still this. I need to up the dose from 10 to 20. If you know that you have not been taking it like you're supposed to, just tell the doctor. Tell the doctor this, don't increase it. It's my fault. I have not taken it in 2 or 3 days. And if you know you're going to the doctor, take your medication, because they're going to look at that number and they're going to say, oh, you're not working. It's not working. Let me put you on another medication. So medication. So food, when you get your instructions for your medications, always look at the food interactions, look at the other over-the-counters. We got to be very careful with over-the-counter medications and diets and supplements, because they do interfere with the absorption of your medication, and it will make the medications ineffective.
Okay. Causes of acid reflux and relationship to diet. I'm not sure of the question there, but
well, spicy foods.
Mm-hmm.
Spicy foods. So you need to eat bland. But a lot of the acid reflux, it can make you feel like you're having a heart attack, is that after you eat, you must sit up for a few hours. So you can't eat at 8 o'clock and be in the bed at 9. You will wake up at 1 or 2 o'clock in the morning. I know. I know. So, recommend that you sit up at least 3 hours after eating your last meal. Drink plenty of water and avoid spicy food. Even caffeine will interfere and give you GERD. I drink decaf, but it's still, I still have issues, because decaf is not 100% decaf. So some of the things when we get older, we have to change. We have to change our diet. Spicy foods, caffeine, we can't eat it because it does interfere. and it goes up in the chest, and it make you feel like you're having a heart attack.
Okay. And what can a person who is unable to walk and have poor circulation do to improve blood circulation in the legs and feet?
Okay, sometimes the doctor will put them on medication, just like when we're on medications for cardiac to dilate the vessels. Because you know, when you have high blood pressure, those vessels get so stiff that the blood has to push its way through. And so that's why the doctor gives you blood pressure medicines, the rest, and the dilate. They can do the same thing for the leg.
Okay.
Now, far as someone who has it and don't want to seek medical attention, I don't advise that. I think you need to go because there's things that you do. But just remember, a lot of times that when you don't have good blood flow, the tissue can die. Just like it dies in the heart, it can mess with your lower feet, and then you have decreased blood flow, and then you start getting ulcers on your feet. Okay. So you have to seek medical attention, but they do have medications and they do have procedures for that.
Okay. Our time is running out, but Dr. Yolanda, I have two final questions. So, what about apple cider vinegar? Is it good for you? If so, what are the benefits?
Taste. It's not to replace blood pressure medicine, if that's what the question is leading to, because a lot of people say, well, if I take the vinegar cider or apple cider, that will help with my blood pressure. If that is the case, then people wouldn't be on medication. I'm glad you brought that up. One of the things that I do have an issue with is the internet. We get a lot of information off the internet. You know, I heard that I can do this and not that. How many people take a substitute? Because it is easier to drink vinegar water and apple cider to help with the blood pressure, but it would not dilate the artery so the blood can flow. It tastes good. It may benefit other things. But when you listen to the internet and you don't seek medical attention, that's why they got these dialysis centers all over. They got dialysis center up like they got Walgreens. That should not be. They have young people who have stroke walking around here on a cane at 40 and 50 years old. And I'm just going to tell you, one time I was in CVS and this man had took his blood pressure. The blood pressure was like 180 over 120.
My goodness. I
said, me being nosy and a nurse, I said, hey, bro, what you going to do about that? I'm good, sister. I'm good, sister. I'm like, you're not going to see a doctor about that? No, I got a problem with taking all that medication. I'm a man. I got to be able to do things. I said, well, I'm just going to say this. I hope you change your mind, but just remember, if you have a stroke, you ain't going to be able to do nothing anyway. So, seek medical attention. But the question, we have to be careful. We cannot substitute apple cider, not for anything with cardiovascular. Not.
Okay. Thank you so much, Dr.
Thank you.
Send us some hearts in the chat on Facebook. Leave Dr. Yolanda a message. If this has been helpful, this has been so helpful. To me, I have learned a lot. Thank you for answering the questions. I am going to turn this, before I turn it over to our president and CEO, I just want to remind everyone we're here all week talking about our health. And tomorrow we're going to have Don Vicky Foster, the general manager of Chicagoland Fat Loss Camp out of Maxon. And she's going to talk about exercise. Our topic is Let's Move. And she is going to actually lead us in exercise tomorrow. So come prepared, dressed in your workout clothes, and let's be ready to work out tomorrow and learn about exercise and how we can start to get that BMI down. Dr. Yolanda talked to us about. And we have healthy eating on Wednesday. We have digestive on Thursday, and we have reproductive health on Friday. but we'll talk about each one each night. But I'm going to thank you, Dr. Yolanda, once again, and present to you our president and CEO of Watch Global Ministries, Pastor Brenda Stringfellow.
Thank you, Dr. Harper-Morris. You did an awesome job. I have a whole page of notes, even though I came in a little late, but I knew you guys could. We're going to do a phenomenal job. To all of our supporters, our viewers, you want to invite someone, encourage someone to come on, share this on your Facebook page, and be with us on tomorrow and every day this week, Tuesday, Wednesday, Thursday, Friday. And also, I want you guys to know that even on Saturday, we're not going to have a Zoom for us, but I want you to be live with us on Saturday at 12 noon. Our Hot Shot, our Man Cave division of Watch. Hot Shots are having their Hot Shot Challenge. Our Man Cave is having their Hot Shot Challenge, 12 noon. We have 4 awesome teams from teenagers all the way up to our seniors that will be shooting for from the free throw line, from layups to 3 points to 4 points, to give them something to do. It builds the adrenaline. It's exercise, and we're going to announce we'll be live on the scene. I want to thank Elder Shamika, our Director of Education, for putting together such awesome and wonderful challenges. I cannot wait for tomorrow to see Dawn Vicky of the Chicago's Fat Loss Camp. She's going to be here. She's excited. I can't wait for Wednesday to see our own Bishop Trotter, our pastor, with a live cooking show. I called him. I'm like, Bishop, did you need somebody to come over to enjoy that cooking? And he was like, well, that's going to be my Wednesday dinner since I do it on Wednesday. I'm like, okay, thought I'd help you out. And I can't wait to hear from the coach, health coach on Thursday, my daughter, Kelly Davis. I'm excited for her. And then also on Friday, as they said. So you guys, this is such a wealth of information. It's a blessing. We're going to get it in. We're going to be healthy. We've had all these challenges for the last months that we've been doing this, last year, this year. And again, you guys be on time on tomorrow. Let's be free. Let's be well. Let's just be G'd up, you guys. I thank you all so much for coming, and you have a great evening. God bless you all.